have also shown that women older than 50, 55 have increased risk of breast cancer. So the older the woman becomes, there's increased risk of many diseases, including breast cancer.
Breast cancer. And again,
Yeah.
you know, the screening that we do usually starts at around 40 to 50,
Yes.
but it can extend, it's recommended to extend until 75. Women after 75 can still get breast cancer because, as I mentioned earlier, advanced age, the older the longer you live, the more your risk of getting different diseases, and breast cancer definitely is one of these diseases that increases with age.
Right. What about race? Is there anything about race? Because I know literature state that Caucasian women are at higher risk of breast cancer.
Yeah, we're not exactly sure why this is, but that has been found to be true in studies. Also, in certain ethnicities, like in Ashkenazi Jews, there is an increased risk of breast cancer, and that may be due to genetics.
Right.
Also, the different mutations in the genes.
You mentioned genetics. Why don't we talk about that particular genome that will increase? If the woman is tested to have those genes, then they're at higher risk. What are those genes?
There are certain germline related mutations. There's one called BRCA1 and also BRCA2. And there are actually a lot of other mutations that have been discovered that when we test for the genes, those don't necessarily come out as BRCA1, but they're mapping more of these genes, and these have been identified even here in the South Texas community to be the cause of breast cancer in certain families, in certain women.
Right.
Yes.
So should we motivate the ladies to be tested for genetic types, or that's not necessary?
Well, it depends on the family history.
Right.
The family history definitely is a factor. If the woman has a mother or a first-degree relative, second-degree, even third-degree relative that has had breast cancer, ovarian cancer, any pancreatic cancer, prostate cancer in the history, then these are definitely people who are at higher risk. And especially if there's been, the age, if it's less than 50 or 45 now, where this has been diagnosed, or if there are more than 2 family members, then definitely they're at higher risk for breast cancer and should be screened if screening has not already been done in the family.
Right. So that is a mother, a child, or a sister.
A sibling, yes.
Right. It's also said that if a man and a child have been diagnosed with breast cancer, then the risk is also increased.
Again, there are 2 family members.
There are 2 family members, right. What about personal health history? Say, for example, somebody has a breast cancer in one breast. Is there an increased risk for having breast cancer in the other breast?
There definitely is an increased risk of having breast cancer in the other breast, and also in people who have had biopsies previously for atypical findings, atypical hyperplasia, ductal carcinoma in situ, other conditions like this. They are at increased risk for breast cancer. So they would be in the high-risk screening group as opposed to the average screen group.
Right. So we can look at the risk factors into 2 groups, those that are modifiable and those that are not modifiable. It's very hard for the woman to select what family they're born in, right?
Yes.
But there's certain modifiable risk, like lifestyle habits, that can also increase one risk for breast cancer. Let's look at alcohol. Now,
alcohol increases the risk of breast cancer. Excessive alcohol uses are even more than moderate. I mean, 1 glass a day of wine, I guess, is considered acceptable. But excessive alcohol intake, smoking, diet, increased BMI, our lack of exercise are also risk factors for breast cancer.
Let's talk about alcohol, because many people might be thinking out there, so what about alcohol? How much can I drink? Now, the literature reveals that if a woman drinks more than 3 alcoholic beverages a week, then the risk for breast cancer is increased by 15%. And what is a drink? 12 ounces of beer is a drink. 5 ounces of wine is a drink, and 1.5 ounces of hard liquor is a drink. So 3 or more per week will increase the risk by 15%. Now, if that person drinks daily, then there's an additional increased risk by 7 to 10%. So alcohol should be avoided or should be reduced in terms of consumption. Now, why is it then that alcoholic use increases the risk of breast cancer? What do we know about that?
I'm not sure specifically what the cause is. Maybe you think
Yeah, I
more
can
about
probably
that. Okay,
say
go
so.
ahead.
Now, it is believed that the consumption of alcohol will increase the level of estrogen, and estrogen is the problem. High levels of estrogen in the blood will increase the growth of the cancer cells. And studies have shown that women that are diagnosed with breast cancer usually have a high level of estrogen, and women who consume alcohol will also have a high level of estrogen.